bit. Good morning, everyone. I'm Steve.
And I'm Scott.
And together we're Backyard Musings, broadcasting live, People's Republic of California.
And we are talking about a great science and technology subject.
Mosquitoes.
Yeah, this is fantastic.
A simple pill may be the latest breakthrough in the fight against malaria. A massive study across Kenya and Mozambique found that mass administration of ivermectin, an antiparasitic drug, reduced malaria cases by 26%. I used to take quina something in Iraq for malaria, anti-malaria.
Yeah.
But I think that had ivermectin in it.
Well, this was something that they tried to use for COVID too, right?
Yeah, and the media laughed at Trump for doing that.
Yeah, but it works.
It works,
right? Yeah, it works.
The pill works in a surprising way. It makes human blood deadly to mosquitoes, killing them after they bite. The key there is after they bite. It doesn't stop them from biting. All right. Yep. This novel approach could complement traditional tools like bed nets or what's that? Sentinella, which have lost effect. That's
the candle.
Yeah, the candle. Yeah, which have lost effectiveness due to mosquito resistance. Yeah, they resist. Even better, communities reported fewer lice, scabies, and bed bugs. That's good.
Yeah.
Bonus benefits from a single monthly dose. The research was published in the New England Journal of Medicine on July 23rd. Would you like to know more?
Okay, and before we get into this, though, this ivermectin has been around for a long time, right? They came up with this stuff back in the, for when they were fighting in the jungles of Africa and South America or wherever. So this stuff has been proven. That was one of the things that they pushed for the COVID. It's already been proven now. Track record, but yet they still kind of mock
Trump.
it.
Yeah, Trump. The arrangement system doesn't care what he says.
Yeah,
they'll mock it, and try and knock it.
Yep.
Like tariffs. They mocked tariffs and it said it's going to ruin the economy. And has it ruined the economy?
Look at the amount of money that we've gained as a country, and no taxes have been raised.
Yeah,
and they may have to raise taxes. I'm not saying that they won't. I don't think they will. He says he won't, but. Everybody's out there saying, all these things are going to go up, but he's getting all this money from other people that should have been ponying up a long time ago.
Deals, big, huge deals. Have you ever heard deals like that with Biden?
Yeah, well, Biden didn't even talk to people.
No,
I mean, he just
you got to get
in the
out
basement
there and talk.
or the nursery or whatever. Anyway, a safe and widely available drug, ivermectin, has shown promise in reducing the spread of malaria when given to entire communities. In the largest study of its kind, known as the Bohemia trial, researchers found a 26% drop in new malaria infections, even when standard tools like bed nets were already in use. These findings highlight ivermectin's potential to serve as an added layer of protection to malaria prevention. The study was led by the Barcelona Institute of Global Health, supported by the La Quexa Foundation. Butcher alert. I'm just telling you that it's just going to happen. So, in collaboration with the Manhika Health Research Center and the Kemry Wellcome Trust Research Program.
Okay. Yeah. Good backing. Malaria continues to be a major global health issue with 263 million, so 250 million cases. That's to add some flavor to it.
That's a lot.
And almost 600,000 deaths recorded in 2023. That's a lot.
That is a lot.
Existing prevention tools such as long-lasting insecticidal nets. I got issued a net.
For your bed?
No, in the military for your cot.
Yeah, for your cot or your bed.
Cot, yeah. As a standard issue. And indoor residual spraying are becoming less effective. This is largely due to mosquitoes developing resistance to insecticides and changing their behavior to bite outdoors or during times when people are not shielded by these methods. These challenges have created an urgent demand for new approaches to stop the disease.
So if you use ivermectin and off or some kind of
DEET or
some kind of
citronella.
Yeah, something on your skin, the spray stuff.
Yeah.
You should be pretty well good, right?
Yeah.
Because even if one gets through,
you want to get them to stop.
done.
Yeah, but
One
then
and
they
done.
die. They can't breed. So yeah.
And then they have this other stuff out there now called Afterbite. Have you seen that?
Oh,
Or
no.
heard? You never tried that?
Oh no.
Yeah, it's like a little wipe-on stuff. It's almost like an alcohol type material. It works pretty good if you catch it in time. Like I got bit a couple times this last time we were in Utah. It had to be by some kind of a spider or something, but it just destroyed my arm. But and I didn't catch it in time. So ivermectin is typically used to treat neglected tropical diseases such as onchocerciasis.
Yeah.
Okay.
River blindness.
River blindness. Yeah, let's just do that. And lymphatic filariasis, elephantitis. I've heard of that. So, however, studies have shown that it can also reduce malaria by killing mosquitoes that bite people who have taken the drug. As resistance to insecticides increases, ivermectin may offer a new and effective way to reduce transmission, especially in areas where standard methods are no longer reliable. So
yeah,
I wonder if you can. Yeah, I wonder if you can build up immunity to the stuff, or eventually, of course, it's not you really; it's the mosquito.
Yeah, I don't know. Maybe the Bohemia Project, broad One Health endectocide-based malaria intervention in Africa. Say that 5 times. Founded by UnitedAid, tested this idea through 2 large-scale mass drug administration trials in regions with high malaria burden. Kwale County in Kenya and Mopea District in Mozambique. Researchers evaluated whether giving a single monthly dose of ivermectin over 3 months at the start of the rainy season could lower malaria transmission. In Kenya, the program focused on children aged 5 to 15, while in Mozambique, it targeted children under the age of 5.
In Kwale County, Kenya, children who received ivermectin experienced a 26% reduction in malaria infection incidence compared to those who received albendazole, the controlled drug used in the study. The trial involved over 20,000 participants.
That's good.
Yep, and more than 56,000 treatments, demonstrating that ivermectin significantly reduced malaria infection rates, particularly among children living further from cluster quarters or in areas where drug distribution was more efficient. Moreover, the safety profile of ivermectin was favorable, with no severe drug-related adverse events and only mild transient side effects already seen with ivermectin in campaigns against neglected tropical diseases.
Yeah,
they're spraying it now.
The side effects I remember from the chloroquine, that's what it was called, chloroquine.
Yeah.
That was diarrhea. I didn't like taking them.
We don't like that.
So I'm just going to say right now, I didn't take them.
Yeah.
Just threw those pills away.
Yeah.
But I was going to say, 26% success rate. Remember the 600,000 deaths that they said? That's 26% saved. 1/4, that's 150,000.
That's a lot.
People saved.
Yeah.
That's more tax revenue coming in.
Yeah.
If they're working. In addition to reducing malaria transmission, ivermectin MDA offers significant collateral benefits. The Bohemia team found an important reduction in the prevalence of skin infestations such as scabies and head lice in the ivermectin group in Mozambique, and the community reported a major reduction in bed bugs in Kenya. Bed bugs are hard to get rid of. These effects are particularly valuable when ivermectin is integrated into existing delivery systems, maximizing its impact on public health.
The study is part of a larger global effort to assess ivermectin's potential in malaria control. The findings have been reviewed by the WHO.
The group, the WHO?
I think it's more like the what is that? The World Health
Order.
Oh,
okay,
right?
Not the band. Not the band.
Yeah, our buddies that were teamed up with Fauci, right?
Oh yeah.
So they concluded that study had demonstrated impact and recommended further studies. Findings were also shared with national health authorities as they evaluate the potential inclusion of ivermectin in malaria control programs. Okay.
Yeah.
That's still me?
Yeah. Well, okay, I'll take it.
No, I can do it.
Go ahead.
This research has the potential to shape the future of malaria prevention, particularly in endemic areas where existing tools are failing, concludes Regina Rabinovich, Bohemia PI and Director of ISG or IS Global's Malaria Elimination Initiative. Quote, with its novel mechanism of action and proven safety profile, ivermectin could offer a new approach using a well-known, safe drug that can add to the effect of other mosquito control tools available today.
Okay.
Yeah, that's a good one.
Yeah. Knocks him dead, but still you got to get over the bites. But like you said, if you can take that medicine and spray up, you'll be good.
And then use the afterbite as soon as as soon as you feel the effects.
There's been some technological advances in mosquito protection. Yeah.
Yeah, and I know people that they get bit, and it's awful.
Yeah.
I mean,
big old bump.
I've never really been affected by mosquitoes too much, but
your blood doesn't taste good. It's not
I don't
sweet.
know.
It's bitter.
Probably, yeah.
Bitter blood.
That would make sense. But it just, but I mean, I know people. So there's some people in my family, man. They get bit, and it's like swelling time. Just terrible. But anyway.
All right, folks. Thanks for joining us. We'll see you in the afternoon.
Take care, everyone. Thanks.